Hello and welcome back to Mental Wellness Studio by Disha. I'm Samindara Sawant, clinical psychologist, and today I'm going to talk to you about dealing with depression. Depression is a word or a feeling that most of us are familiar with. We have all experienced moments in life when everything just seems too miserable and it just seems such an effort for life to go on. All of us have gone through stresses from time to time in our life, and we know what it feels like to be down in the dumps. Yet, depression is a mental illness and as such deserves to be treated with seriousness and looked into it with the right approach. So let us look at what are the few things we need to do if we suspect depression. I would first talk about the first two things that you need to do if you suspect yourself or someone you know to be suffering from depression. Firstly, seek medical help. No question about it. If you suspect anybody suffering from depression severe enough to warrant a diagnosis, please seek a psychiatric consultation. It is a psychiatrist who will be able to decide whether the depression is severe enough for you to require medication. The medications work on trying to balance the neurochemical imbalance and thus work on reducing the symptoms. Secondly, seek therapy. It is the psychological intervention, the therapy that you seek for the depression that is going to help you deal with depression and its aftermath in the days, weeks and months and years to follow. While medication and therapy will remain your two primary sources of intervention, there are several other things you can do to help yourself get out of depression. Firstly, identify your triggers. Try and introspect a little bit and get an insight into what is it that triggers your feelings of low, blues or depression. Is it the fear of being alone? Is it something to do with work? Is it a relationship that's not working out? What is it that is creating this feeling, this hopelessness, this sadness within you? The more you are able to identify your triggers, the better you will be able to work on these, both in your therapy sessions as well as by yourself. Secondly, make lifestyle changes. Depression usually tends to mess up with your sleep cycle as well as your appetite. You either end up overeating or you end up not feeling hungry at all. So as much as possible, if you can ensure that you are getting adequate sleep and you're eating adequately and nutritious meals, it will help you to that extent to try and bring your body cycle into as much balance as you can, which in turn will contribute to a general feeling of overall well-being. 3. Lean on your support system. When you're feeling depressed, it is usually a good idea to reach out to people you care about and who care about you in turn and let them know what's going on. It's also helpful to let them know how you would like them to help you and support you as you deal with your depression. 4. Revive your hobbies. One of the casualties of depression is that the hobbies and interests that you used to enjoy no longer seem to offer that joy to you. Hence, trying to push yourself to get into activities that you used to enjoy once upon a time, even if it seems like too much effort and too much energy, will help you to slowly get yourself back into some sort of a routine, especially with activities that you find relaxing and helpful. 5. Breathe. Using any kind of tool or technique that helps you relax deeply is one of the best ways to calm yourself and feel good about yourself and life in general. Yoga, Vipassana, Brahma Vidya, Pranayam, or any other breathwork technique is one of the best ways that you can utilize to get yourself into feeling more centered, more grounded, and being able to view what's happening to you with a kind of detachment and objectivity that will help you process these feelings and emotions better. Lastly, join a support group. It helps to know that you're not alone. A support group puts you in touch with many others who are sailing in the same boat as you are. And interacting with people who have gone through or are undergoing similar feelings, similar emotions like you are, can help you create a network, a strong support for each other to help you overcome these feelings. One last word of caution. While the above mentioned strategies can be a very useful adjunct to your medical and psychotherapeutic interventions, they cannot replace your first line of treatment, which needs to be medicines and psychotherapy.